Hi, Dr. Toro. This is Whitney, and this is my Nurse Informatics Impact presentation. Please excuse my blue pimple patch here. I didn't have any clear ones. This presentation will cover why nursing informatics can help an organization like mine deal with a current problem that we are experiencing. Nursing informatics is where nursing and technology come together. It's all about using tools like EHRs and data systems to improve healthcare. According to the ANA, nurses in informatics use technology to optimize the use of EHRs and track data to keep things running smoothly in healthcare settings. Why is this important? It helps healthcare workers make smarter choices, reduce errors, and boost patient safety. As healthcare becomes more and more tech-driven, they play a key role in improving patient care and the system as a whole. A specific problem in my organization is the transition of ESRD, end-stage renal disease patients who have crashed into the hospital and need emergency dialysis and will continue to need it after discharge. So these are the patients who have not had time to work with the nephrologist ahead of time, prepare for their dialysis needs. They've gone into the emergency department feeling unwell, and next thing they know, they need dialysis. So the timelines vary per patient, but some need dialysis right after discharge, and some can wait up to a week before their next dialysis session. During the time after they are discharged from the hospital to the time that they are admitted into the in-center facility, there is what I would label it a black hole, where there is little known about the patient. The hospitals aren't responsible for them. Technically, they haven't been admitted to the dialysis facility, so the dialysis facilities are not responsible for them yet. During this time, there's a lot of missing communication and not a lot of direct oversight. It is not uncommon for a patient to show up on the wrong day assigned for their dialysis session, and they have to come back when there's no chair that's available, so they have to come back when one opens up. Another issue that doesn't affect patients as much is the insurance piece. Oftentimes, there are payment delays due to not getting the correct insurance input during the transfer. Interoperability gaps. I hope I said that correctly. But this is where I think nurse informatics would be useful by integrating the hospital discharge information directly to the facility's EHR. Currently, this is not happening. There are usually one or two liaisons involved in doing manual work of calling and faxing paperwork, inputting information manually, again, lab values, to get this patient admitted into the facility. This may require a third party quarterbacking the calls between the hospital, the insurance company, and the facility, retrieving hospital lab immunizations and insurance information and typing it into the system before sending it to the facility. In a study done by Chow and Sokolow that looked at interoperability between home health care and primary health clinics, faxing documents was the primary way of sharing data, which is also how my dialysis organization still transfers a lot of their documents when admitting a new patient. The study used the United States Core Data for Interoperability, also known as USCDI Interoperability Standard, and it showed that over 70% was not up to the standard. So obviously, it was heavily recommended to use the USCDI standard to address these gaps. Here are the 3 items of my proposed informatics solution, and in the next slide, I will discuss why. I propose not only integrating the local hospital's EHR and the facility's EHR, but also integrating the patient's preferred method of communication in that as well for more accurate and timely transfer of information. This would help connect the patient to the facility ahead of admission for accurate chair times and health questions, so they're not just showing up on the wrong days or the wrong times and then have to wait hours before another chair opens. Capturing the patient's preferred method of communication ensures that they stay informed with reminders about appointments and critical information. A lot of these patients, they crash into the hospital and they're feeling foggy, they're not feeling well, and they're given a lot of information on top of dealing with this crazy diagnosis that they have to now deal with. And they're expected to remember a lot of these details. If we could capture that, if they prefer text or email, we can send that to them so they don't have to remember so much. Also, AI for predictive analysis, I think, would be super helpful because this would allow clinicians to identify patients who are at a higher risk and prioritize check-ins. Right now, like I said, dialysis centers are not responsible for these patients because they haven't been admitted, but at least with this predictive analysis tool, a lot of our clinicians, a lot of the nurses, they do care about patients even if they haven't been admitted. They'll follow up if they know that this particular patient is vulnerable. So, stakeholders. In no particular order, these are the people the stakeholders that I think would have to be involved in getting these two organizations to share data electronically and safely. Many of these roles function in silos currently, so they would all have to be involved to create a comprehensive system. A few outcomes we're aiming for with this. It would streamline tasks for in-clinic personnel. In one of the studies I had read, EHR interoperability helped with medication safety, reduce cost, and reduce the number of occurrences in patient safety events. Instead of having to wait for fax records to be sent and then uploading them and individually typing everything in, it could just automatically populate into the necessary areas. This would also, of course, reduce wait times because we're no longer waiting. It's no longer dependent on a discharge planner to have to find or track down certain documents or immunization records. They could just quickly type in, pull up a search in their EHR and transfer what they need to populate in the medical director's computer for review to approve the admission. It would also help with efficient time management. It would prevent treatment delays by ensuring that the patient has the right location and right time to come for their dialysis appointment. And I think this is a really big one too, decrease patient anxiety about next steps. By having everything automated or accessible on the phone, it would decrease the anxiety for the next steps for the patient and offload some of that knowledge burden that they might have. Listed are the technologies that would be required for this. The EHR, a lot of clinics are already using EHR, but this should be optimized so that they're not operating in silos at the mercy of human error where transferring information is oftentimes still done manually. Telehealth messaging platforms. This allows the patient to stay connected to a clinician who could help them with their health concerns. Scheduling systems. This would help streamline the current process, which involved currently 3 parties: the hospital, the facility, and a scheduling liaison that's part of the facility but more so contracted. And then lab systems. To maintain accuracy, currently, the initial labs are manually being inputted. Of course, once they're admitted to the facility, everything is more automated. But just that initial one, if we could get the 2 facilities to talk to each other, facility and hospital, it could be directly transferred, and it would be less likely to be at risk for errors by manually inputting those numbers. And then finally, data analytics to help with the predictive analysis of high-risk patients that need more follow-up post-hospital discharge. So to the left, we have the project team, so people that would have to be involved in making this happen. I'm going to highlight the nurse informaticist. They would contribute to the project by collaborating with stakeholders, by teaming up with doctors, nurses, IT department, and other staff to figure out what everyone needs from the system. This way, it works for everybody. They would also map out the workflow to see how everything should flow between the scheduling and admission systems so that data moves smoothly and no one's left guessing. They would facilitate system integration by collaborating with IT to make sure the scheduling system and the dialysis center's admission system play nice together, especially with the hospital's EHR. This keeps everything running without hiccups. After the system is up and running, they'd have to keep an eye on it to make sure that it's working well. Technology is not without its hiccups, right? They'd also be able to gather feedback and make any changes to keep things running smoothly. And finally, because we are dealing with a lot of sensitive patient health information, the nurse informaticist would help ensure the integration meets healthcare regulations like HIPAA and maintain data integrity. In one of the articles that I had read, one of the biggest concerns sharing data was security, especially when the exchange is happening between different organizations. That's a really big deal or big concern. So having personnel well-versed in nursing informatics technology is essential to addressing safety issues such as maintaining security and integrity without breaking the quality of patient data. Parsi's human becoming theory is all about seeing patients as active participants in their own health journey. It focuses on understanding each person's unique experiences rather than just treating their symptoms. The idea is to connect the body, mind, and spirit to help patients find meaning in their care. The nurse informaticist can use this mindset to make sure the technology doesn't just focus on the medical side, but also takes into account the human experience for both patients and healthcare workers. For example, pushing for a system that's easy to use, not just having everything on there, but just also making sure that it's simple and streamlined so that it can reduce stress for everybody and also improve communication so the whole process feels smooth and more personal. The human becoming paradigm is all about empowerment. The nurse informaticist can make sure both patients and staff are involved in the system integration. They can gather feedback from patients about their experience and help staff feel confident using the system, and keep the feedback loop open to make sure that the tech works well for everybody. In conclusion, fixing the communication gap, often referred to as the black hole, between hospital discharge and the outpatient dialysis centers is crucial for improving patient outcomes and increasing care efficiency. Right now, there's little oversight during the transition, and patients can end up with errors in the dialysis appointments impacting their care. By connecting the hospital's EHR with the dialysis center's system and using predictive analytics, we can ensure a smooth, well-coordinated transition, reducing mistakes and delays in treatments. This will have a direct, positive impact on patient outcomes by making sure that they get the right care at the right time. Plus, it would streamline the process by eliminating manual data entry and speeding up insurance verification, making everything more efficient for both patients and staff. Ultimately, solving this black hole will improve care quality and make the entire process run more smooth.